This is the Physical Activity Researcher Podcast, a podcast for researchers of sedentary behavior, physical activity, and sports. Join for a relaxed dialogue about research design, practicalities, and, well, anything related to research. Learn from your fellow researchers useful and relevant information that does not fit into formal content and limited space of scientific publications. And here is your host, researcher and entrepreneur, Olli Tikkanen.
Welcome, everyone. I am very excited about the guest of today's episode. He's working as a medical doctor at private Latour Hospital in Geneva. He's manager of health and performance at sports medicine department. Among many other things, he has been doing sports medicine development and research at Stanford University in US, have played basketball in Swiss national team, and have been amateur triathlete completing the Ironman. Ladies and gentlemen, I am honored to introduce our guest, Dr. Boris Gojanovic. Welcome, Boris.
Hello, Ali. Thanks for having me on the podcast.
Thank you for taking the time in the podcast. So how is everything at the moment in Switzerland?
Yeah, well, the situation is slowly coming to a change in Switzerland. So we've been in a bit of a partial or relative lockdown for the last 5 weeks and a half. And but people were still able to go out, not only for absolute necessity, as in groceries or people who had jobs that they had to continue, but also it was still possible to go out for a walk or for leisure activities, whilst it was important to respect the gathering of maximum of 5 people and social distancing recommendation. So that's been the situation. And just recently, our government, that was last Friday, announced progressive coming out of the confinement and the lockdown strategy for the next 2 months gradually, which means that basically in a couple of weeks from now, 2.5 weeks from now, schools, or 3 weeks from now, schools will reopen. And so that's a little bit the situation. For me personally, I've been doing my work from a distance. So I've been doing a lot of teleconsulting, and we'll probably get into that a bit later. But it's been special time, you know. It's everything is changed for the way we practice what we do. I am not directly involved at the front line of emergency medicine, so I'm trying to accommodate a little bit the situation.
And as a medical professional, how do you see this whole situation, and how do you see this plan of going out of the lockdown progressively in the next 2 months?
Yeah, look, there's many questions around that, and obviously we don't have all the answers. So if you look at the media and social media in general, you'll have a ton of different opinions from experts, real experts, so-called experts, etc. So I'm not going to have here an expert discussion, because I'm not an epidemiologist and I'm not an infectious disease specialist. So from the medical standpoint, I think one thing we've observed is a strong reduction in consultations, also for emergent matters, as in heart attacks, for example. There's been a very important reduction in the number of consultations for chest pain, and potentially that might be a concern. Now, obviously, people not consulting for things that are not really dangerous and don't matter urgently, I guess it's not a bad thing, and people can cope with minor issues. But definitely there's been a bit of worrying about people not going to doctors because they're afraid, or not going to the hospital because they're afraid of COVID-19. And whilst they may have health issues that need to be looked after. So that's one thing. On the other hand, I think the questions we have is we don't know how many people are actually infected or carrying the virus and potentially contagious. We don't really know if the asymptomatic people transmitted much. And I guess we don't really know who develops immunity or not. So those are all questions that we have, and that we're looking forward to the research that's very active and that's trying to get those data out for us in the coming weeks and months, so that we can manage it as best we can.
Yeah, so you have been doing telehealth, you have been distance work. How has it been going as a medical practitioner?
Yeah, it's been really interesting. Obviously, when you medicine, when you study medicine and at the faculty, and then as you work on your craft a little bit further on, you put a lot of value on relationships with your patients. The act of medicine or the art of medicine, and be it listening or physical examination, and know your clinical signs, and really make a very thorough physical examination and tests, etc., to get to your diagnosis. So when you grow up as a medical doctor with all these ideas, the thought of telemedicine is actually almost insulting, because how can you reduce the art of medicine to just a screen or a phone, and just having a discussion and looking at things? So that's one way of looking at it, and I've oftentimes heard those comments from people in the medical sector. But I think there's more to it, and I've been really interested in those aspects of medicine in the last few years, all the e-health, mobile health, and also telehealth. But I haven't really pushed it because I didn't have to. I had my
Mm,
patients coming in the hospital, I have all my consultations. There's a lot of work, so nothing pushes you to do that. But still, there was something that was teasing me, because imagine the following situation. You have somebody who has a minor ailment. Let's say, I do sports medicine, so oftentimes people will complain of knee pain. Maybe minor knee pain is because they're running or because they've started an exercise program. And
mm,
you'll have people that are maybe highly active professionally, privately, they have a family and all that. And these people will take about 3 hours of their day, 3 or 4 hours, to, even if the hospital is not very far from them, but just to get there on time, make sure they have enough time, and then go back to work, etc. So for those, some of them, it's half a day
mm,
they'll take just to have a little discussion about what's happening to their knee. And
mm,
sometimes you realize this could be done from a distance, and you could give sound advice for someone who hasn't really heard about sound training advice and progression and things like that. So, with all this considered, when the coronavirus pandemic erupted, and then we saw that things were going to go in a way of a lockdown, and people would have to stay at home and would not be able to come to the hospital and to my practice to do their consultation. Actually, what I did is, on day one of the lockdown, within 1 hour, I was set up to do telehealth, and it's not complicated, really. I mean, all you need is a video consulting software or teleconference software, and there are many out there, and there are no
mm,
rules. That's the thing. We didn't have any rules. So actually, the medical association of our region in Switzerland said, well, you could use some of the tools like Skype or like WhatsApp or others. They didn't really have an idea of what was out there, what was needed. So I
mm,
had a platform I was already using to interact with patients, and that was to prescribe exercises and rehab exercises and training and things like that, which had a video conference module embedded into it, and I started using that, and it works perfectly fine. So again, I mean, with the help of my assistant, and she went home and she stayed home and she organized everything from home. We had shared documents on platforms that are secured, and we got up and got started. And that was the beginning of a new experience, really.
mm,
So, to get back to what I was saying, like the resistance of the medical community to telehealth, I understand where it comes from. But I started thinking about it, and what I realized, and I guess that was a bit of a hunch I had, or intuition that I felt was right, is when you are on the screen and you are talking to someone, you're actually listening a lot more, because you can't jump from your chair to go examine that knee or whatever it is that the person is complaining about. You've got to
mm,
listen. You've got to take the time. And actually, that part of medicine is so important. we know the value of taking a medical history, but this is almost all you've got, right? I mean, it's a huge
Mm.
part of what you got is the medical history. Sure, you can guide your questions and all that, but you will interrupt a lot less, I think, on a screen, because you have to listen. That's what you've got. And then the part of physical examination is actually quite interesting because there's a lot of things that you can do when we talk about sports medicine and physical activity medicine. There's a lot of functional testing that you can do. Actually, it's just looking at how people move and how they execute some movements, be it general movements or be it just specific movements around a joint, etc. So there's a lot of
Mm.
things you can do, I find.
Mm. And how do you see that there was no regulation with the telehealth? Do you think there should be some specific software which is encrypted and so on, that it is safe, the data is safe even in the discussion and in the video call?
Yeah, obviously, I think that's a requirement, and there are international requirements, the GDPRs for Europe, and most of these softwares are compliant. So that's one thing. Then there's a specific regulation within the country that has their requirements as far as where the data is stored, the servers, and how it's encrypted, etc. But I think some countries are not very far ahead in the digitalization of many aspects of our lives. And Switzerland, it may be surprising, but it's not very advanced in that aspect. Even for electronic health records, we don't have systems that are really spread across the country. There's quite a few companies that offer some electronic health record solutions, and most of the solutions do not communicate with the others. So there's a problem of transmitting information in a safe way across the different partners of healthcare system in Switzerland. So that's a bit of a concern. And the other thing is, I guess there's been a bit of resistance from the medical community as well. You know, the medical community has not been pushing for digitalization and electronic systems in healthcare, because I think there's a tradition, there's this culture of valuing the physical contact and the physical presence, which again I value and I think is very important, and it gives us more than what we can do digitally. But we have to see these things working together, and I guess for me, for the future, I will continue to use telehealth solutions in addition to the real life consultations that I'm doing. So that's what I would say. Now, as far as the regulations, also there's another aspect which is a bit of an issue now, is that the billing for consultations on electronic platforms is not organized. So what was there for Swiss doctors and practitioners, for example, is that you can bill a telephone call with your patient, and there's a limit of time for that. Specifically, there's a 20-minute limit. Now, in 20 minutes, you can do a consultation and you can do some good things, I think. But really, when people have a story to tell and they have an ailment, you basically need 15 to 20 minutes of history taking. And before you can get them to do some movements, maybe to do a bit of an assessment, and then you have a discussion, and you want to lead that discussion in a way that's a shared decision making discussion, and you want to inform, and you want to make sure that the patient has understood or has asked all the questions. Within 20 minutes, that's really difficult. So that's a bit of a gap there, and people are conscious about it, and we'll see what happens in the future.
This podcast is sponsored by Fibion, a research device that has been shown to be valid in tracking sitting, standing, physical activity and energy expenditure. Furthermore, Fibion has been shown to be valid categorizing physical activity into light, moderate and vigorous intensity. In addition to scientific accuracy, Fibion provides automatically produced and easy-to-understand reports for research participants. Get scientific validation and learn more about Fibion at fibion.com/research.
And how do you see the wearables in telehealth in relation to sport medicine and also in general medical practice?
Yeah, look, I see that as a huge opportunity, and I would like to say so far almost a missed opportunity on many aspects, because it seems that the wearable market and the wearable industry has first developed itself on a client oriented model, or basically you are selling the wearable to a person that's going to use it on his or her own out there. Now, and those wearables are usually not meant to be shared with the healthcare practitioners or the medical community. So that was sort of the initial thing. You can think of heartbeat trackers or movement trackers or pedometers or things like that initially. And then there's a lot more wearables that are coming to the market in recent years. But the problem I see is that for the last, maybe 10 years, with the gradual explosion of the wearable market, people have been buying tools, or they've received them for Christmas, maybe, or who knows, for a present, and they've been using them for a little bit, and then they've dropped them. And unless you're an avid athlete that likes data and that is adamant about recording everything and looking at your data, a lot of people have just stopped either using the tools, or they use a smartwatch or a wearable watch just as a watch and not for all the other aspects that it can bring. So that I find really interesting. And that was basically the starting point. Now, I would say in the past 4 years, I've started working with some of these devices more specifically to counsel my patients and to track a little bit what they're doing. On the one hand, there's the athletes, and they may have a platform, a dashboard where they log everything they're doing. You know, I can have a look at their heart rates, I can have a look at the intensity, the hours of what they're doing, get a sense of their training loads, etc. So that's basically the sports medicine side and the elite sports medicine. And that's nothing new. I mean, it's been done. It's done by coaches regularly. There's platforms that share the data between athletes and coaches. Not very well with third party, as in doctors or other healthcare practitioners, but still it exists, and it's possible to have a look at all that. So that's been helpful, I would say. Then what I found a lot more interesting was to use these devices for people who are actually only beginning or want to begin to move. We're talking about the fight against inactivity, against sedentariness, and just gradual progression into any type of physical activity. And that's where I found there's a very important value in those tools, because what people lack, I guess, when you're talking about physical activity and their health, is a bit of physical literacy. Okay, so what it is that we're talking about, what is movement, what is physical activity, how much do I need to do, etc. And although, I mean, we could go into those questions in detail, and I know you're very fond of measuring these things and talking about physical activity and sedentary inactivity, but I think that these tools provide us with an opportunity to do a bit of education. And the first thing is to have the patient or the person accept the idea of tracking some of the things they do. That's the first step, of the first hurdle. And oftentimes there's resistance there. So I see some patients that I'll offer them to maybe use a device that they have or get another type of device that can be fairly cheap, I'd say, and to share the data with me, and so we can work together on having a look at what they're doing over the week, etc. I think what they get very quickly in that discussion is that if they see the doctor or a coach or somebody else once a week or once every month, I'm not going to see my patients every week for that. Maybe sometimes it's once a month. And I don't know what's happening for the 29 other days of that month. It's really hard for me to counsel them correctly. The discussion is about how can we adapt things, not on a daily basis, but I'd say, on a weekly basis, and see what they're doing and get feedback. So feedback and feed forward is basically communication. If we can get that communication going, but sometimes we don't need to be physically present, but it goes through some data that empowers the discussion, informs the discussion, and then the counseling that can happen after that, I feel there's a lot of value. And obviously, I think it works for quite a few people once they go past that first hurdle and they say, okay, I want to try it. It helps a lot.
And so you have actually been doing this, that you recommend some activity tracker and sharing of the data. How much you have been doing, and how much do you see it has been of benefit?
Yeah, so I guess it's progressing. It's progressing for different reasons. First of all, is I'd say, well, maybe one step back. If you consider, the introduction you made in my activity, okay, I'm a sports medicine doctor and I was an athlete, etc. And here I am talking about people that are inactive and that need to move more. Why would these people come to a sports medicine doctor? That's the first hurdle, I guess. And I work in a place that's known for sports medicine, that's linked to Olympic athletes, etc. So people might be a bit scared to come to us because they would say, I'm overweight, I'm 50, I have never done sports. Why would I come and see these guys? So the first thing is that over the years, I've developed much more of an interest in these people, because I think that everything we do and we've learned through physiology and training and looking after athletes of every level is applicable to a human being, and especially to one that hasn't been moving much and that needs to improve their health. It's only a matter of adaptation of any advice that you will give to the current state, the status of that person. So that's the starting point. And then we've learned so much about the body and the physiology of the body in elite athletes that we can apply that, because it's one body and one physiology. It's just a different type of level. That's all. So that's the first thing. So then you have to make that known. You have to make to communicate with maybe other healthcare practitioners, general practitioners, and all that. I do quite a fair bit of continuous professional development, education in the medical setting, also in the physiotherapeutic setting. And so gradually people have started to hear the fact that sports medicine can also provide some sound advice, hopefully, for people who need to get active. So over the years, and especially the last 5 years, I've developed a growing interest from patients for our services in promoting their health. And the basic tenet of it is usually people, by the time they're 40 or 45, they start to wake up a little bit one day and they look around and they've put on 10 kilos or 20 kilos, who knows. They've stopped doing activity. They've worked so hard. Now maybe their kids are a little bit older and they're thinking, I can't even walk with my kids. We talked about hiking, you and I, and I love to go hiking. And I see parents that have young kids and they don't go hiking because they can't. They're out of breath. And we're in Switzerland. It's marvelous. There's so many fantastic areas to go to. And these people can't do it, and they wish they could. Oftentimes they will come and they say, look, I've got a 5-year-old, an 8-year-old, and I'd like to do activity with them, but I see that I'm unfit and this is a problem, and that's why I want to get back. And at the same time, they may have pre-diabetes, they may have hypertension and other things. So there's all the reasons in the world for them to get active. And that's how, over the years, I've had more and more of these patients come to me. So, which leads us to, how to help people. And it's a long discussion. Promoting physical activity and health is a long discussion on many levels. For the one on wearables, sometimes I'll notice during the initial consultation what they have on their wrist. And oftentimes people will come in and they have an activity watch or something, and I'll ask them, what do you do with it? Oftentimes they don't do anything with it. Oh yeah, no, I bought it, but I don't really know. And it ends there. So we start talking about it. When they don't have it, I ask them about, do you know how much activity you're doing? What could you possibly know? Usually they don't really know. And then when we get into the discussion, I ask, what about steps? Oh yeah, how many steps? Yeah, I heard that might be a way to measure how much I'm doing. So then we take their phones out, and they're surprised to see that their phone has been tracking how many steps they've been doing. So I show
Mm,
them these things and go to the apps that are automatically tracking the steps, and most of the phones have that on, and they don't even know.
mm,
So we don't need, I guess, to get into the debate of how precise it is, but it starts the discussion,
mm.
and they get
And
hooked.
yeah, and do you see mainly it as you said, to empower the discussion, as to get to the level of some sort of physical literacy, and that it's just kind of facilitating these discussions?
Yeah, I think that the goal of a physical activity counseling consultation is to approach behavior. And well, two things, I think: behavior and motivation behind the behavior. And I think it starts by people understanding a little bit what aspects of health are related to physical activity and what physical activity means. And if we can get that discussion to the next level, we can then start exploring motivations and
Mm,
link the motivation that people have to the new understanding or the developed understanding they have about physical activity. And when we have that, then we can get back to the devices, the tools, and the means to get to the next level of activity.
mm. And when you go, for example, to the discussion of steps, do you give some kind of guidelines to people, like progressive goals, or how do you usually approach this one?
Oh, yeah, I tell all of them you got to get 10,000 steps per day.
Yeah,
No, I don't. No, I don't. I don't. Look, we've all heard of the 10,000 steps. And by the way, do you know where the 10,000 steps come from?
I think a Japanese guy thought that it's a
Right,
round number,
right.
and so, sounds good. So I think there's
Yeah,
nothing else behind than
yeah.
a round
It
number.
was
Yeah.
actually a company in Japan in the 1960s that did a little pedometer, and it was a promotion for a company, and they started saying 10,000 steps, and that was it. So there never was any official guidelines for that. It's just been taken up from there. But basically, what I will do is and always stay true to what matters to that person in front of me. So the first thing is to understand where they come from. And where they come from means how fit they are now and how much they're doing. So that's
Mm,
why I try to get an assessment of how much they're doing. And if I have on their phone, it says 3,000 steps on average per day in the last month. If I tell them you got to get 10,000 steps, it's I'm lost. I've lost them, and
mm,
they're never going to get on board with any kind of advice that I will give them, because initially, I mean, automatically they'll say, "Oh, yeah, sports medicine. These crazy people. They think I can do 10,000 steps, yet I'm only doing 3,000." So what we'll do is we'll gradually give a goal to increase by about maybe 20% on some days, and see if they can manage to get to 4 or 5,000 steps on specific
mm.
days, maybe on weekends, and try to maintain the base that they have or increase it a little bit. And then we'll see how it is after 2, 3, 4 weeks, and I'll give them feedback on that. What's really important, if we talk just about the steps, and if it's just the first thing that we look at and that we'll do for the first month or two, what's
Mm,
really important is that I can track it in a way that I can get feedback, and that then I do something with that feedback. You need to act on the feedback that they give you. Because if I log on to their platform of the device that they have and I look at the steps and I say, oh, fine, they haven't changed, and that's it, and I don't react, nothing's
mm.
happening. Whereas if I
Yeah.
contact a patient and maybe just an email, and I'll shoot an email and say, hey, I seen that you've done good last week, and this week you've done a little bit less. Is everything okay? I hope you're doing fine, but keep going. Last week was really good.
Mm,
And it's fascinating. Just that it seems obvious, and it seems a small thing to do, right? But the message the patient gets is the doctor's gone out of his way to log on to the platform and then taken the time to analyze and then sent me an email that's for me and encouraging me to do more. Okay,
mm,
that's a powerful message, because it doesn't happen that often, I guess. And they see it as individualized. They see it as time that you've dedicated to them and that you're interested in what they're doing. And then you're giving them constructive feedback. It's For me, it took me a minute. About a minute. It's really quick. Once you know how to use, you log on, you have a look. It takes 30 seconds to have a look. You write a short email. That's it. But it can make a difference. So that's the experience I've had just for this. And then we can develop further with a bit of a more sophisticated tracking when you look at exercise intensity and frequency, and when people start to really do some exercise, as in dedicated exercise, not just everyday walking.
Yeah, you probably know quite well, as you have been training for a triathlon, about the different intensities. When do you think people are ready to do something more intensive, that it's not too unpleasant if they start and they are quite unfit? They go to 4,000, 5,000 steps probably with quite low intensity. When do you think it's the right time to go to a little bit higher intensity?
That's a great question. I wish I had that answer just very loud and clear for you. But I think I'm going to give the typical answer of it depends. Because I'm not sure. What I certainly see is that there's a lot of people that I see in my consultation that have taken the step to intense activity spontaneously on their own, or with the advice of some friends or coaches, sometimes in fitness areas and all that have done it too fast, too quick, and they come to me because they're hurt, not because they want advice. They come because they're hurting somewhere. And that then starts another discussion on what have you been doing? How have you started? Oh, okay. And you see that somebody's just woken up one day and said, okay, I'm going to register for this class. I'm going to go 3 times a week. I'm going to do CrossFit. I'm going to do body pump courses or whatnot. And even though if you look at all of the specific services that are out there for fitness, and you look at the content of most of the classes, you could say this is good. It's good content, and maybe the progression of a 1-hour class somewhere is good. But the problem is it doesn't always take into consideration where people come from. And they come from oftentimes a very unfit level and a very unsure of their fitness. So people will do what they're told because they're motivated. They're sometimes too motivated, or they say their motivation is to lose weight, which is not the best motivation, I would say. But they will go through whatever the sporting world or the fitness industry offers out there, and oftentimes they'll get hurt. So when I have someone who comes in firsthand without an injury but just wants to start an activity, I'll always start with getting a baseline of gentle fitness. That means a baseline of physical activity. Sometimes we will test the physical fitness really in the lab setting if they're interested, but I'm not pushing for it because we can do without in the initial stages. Some people are wanted because they're happy to see the numbers and all that. And it's good to have a baseline, because if there's one thing we know is people, when they're very unfit or when they want to start something, the baseline is going to be low, and we can improve that baseline within 3 or 4 months very well. So sometimes it's also a good way to motivate them and show them the low numbers at the start, and then repeat that after a few months and say, look, this is great, the progress you've made, etc. So that's another motivation. But I really want to establish a base level of activity. If people come from no activity, a lot of sedentary time during the day, we're going to go through the easy things, how we integrate more walking, how we get a little bit of strength in the lower body through stairs, using more regularly, or maybe some other activities that they might enjoy doing as a family and with their kids, or some playing activity, etc. But really stay a little bit away from the voluntary or dedicated intense activity until they've developed that base. And when they feel more self-confident about their movement, they feel their fitness or their breathlessness improving, then we can talk about adding a bit of intensity. That's where I like to do it sometimes with coaching. I have at my hospital, we have a coaching department as well. And the great thing about it is that we work together as an interdisciplinary team. So sometimes we can really make sure that we get them in once a week or once every other week, or we just track a little bit what they're doing, and we teach them also about intensity. Just as, counting the steps is something they didn't know about, and then intensity is something they didn't know about. You mentioned before me personally as a triathlete. Now, before I did triathlon, I was a basketball player. And I played for many years, actually, at a high level in Switzerland, so very low level outside of Switzerland. And I don't think I learned much as far as intensity of activity. It was play. It was always intense, and I didn't know much about exercise physiology. When I started triathlon after my basketball career, I was like 32, 33. Now, obviously, I was a medical doctor, and I had already developed an interest in physical exercise and science around exercise. So triathlon was really a way for me to learn more and test things on my body, as in how you train, how intense it is, how you respond, how tiredness kicks in, etc. So obviously that's an advantage when you go through the motions and you learn yourself. And oftentimes in the sports medicine or sports and health world, the practitioners have been exercising themselves for some time. So, but I had to learn all that. Even though I had been an athlete before, I still had to learn, what does these numbers mean? How can I use them? And sure, I added a level of understanding through science and through research that was conducting. So, allowing me to understand more and more. But it's the same for someone who's not used to doing any kind of intensity. It's good for them to understand why we do it, how we do it, and how we're going to monitor what they're doing to make sure that we don't overdo it, but also to make sure that we do enough, that the stimulus is right. And we don't want them to get hurt or tired or anything, but we do want to stimulate that cardiovascular system, that muscular system, so that the positive adaptations of exercise happen gradually.
Yeah, that makes all sense.
This podcast is sponsored by Fibion. Fibion is an accurate sitting and physical activity tracking device and analysis platform. It is a great tool for projects that aim for behavior change in sedentary behavior and incidental physical activity. Fibion provides easy-to-understand PDF and web browser reports for participants. Other features include comparisons to recommendations, linking results to health risks, achievement cards, and interactive goal-setting tool. In addition, Fibion provides an API that allows for easy integration to other systems and applications. Learn more about Fibion at fibion.com/research. Fibion, from researchers to researchers.
How do you see for very unfit people, like intense training? It probably has some effect on their immunity, and now there's this coronavirus risk. Do you see any risks for unfit people at the moment?
Yeah, actually, I do. Now, we know a little bit, and I insist a little bit from science and from the literature, that there are positive and potentially negative effects of exercise on immunity. I don't think the jury is quite clear out there on how much exercise boosts immunity or protective immunity against viruses, and how much might be a problem. There's a bit of debate on that, and obviously the studies are very hard to conduct. But if we look at the evidence that we have out there, it seems to point to a reduction of susceptibility to viral infections. So we're talking upper respiratory tract infections in people who are regularly active, from moderate activity to regular training. But when athletes, for example, or people in general train hard, that means at a relatively hard intensity for a sustained period, then their immunity might suffer. The stress levels of the body are too high, and we know that can lead to maybe overtraining or fatigue or lack of recovery, but it can also lead to immunity reduction, and then more susceptibility to infection. We've known that, after ultra races, be it triathlons, be it marathons or things like that, people tend to have, during the training process or after the races, a higher incidence of upper respiratory tract infections. And some studies have shown up to 5 times the incidence of these. Now, they may not be severe, and that's fine. What you get a cold and for a week, and that's it. But when we're talking coronavirus, and especially the current coronavirus, that might be more severe. So what I understand from all that, and I've looked into it a little bit in the past few weeks, is that we have to treat the current coronavirus as a virus that can benefit potentially from moderate and regular physical activity. And we don't know whether that's true or not, but other coronavirus types that are linked to the common cold seem to benefit from moderate physical activity on a regular basis. And on the other hand, we have to be wary of the fact that doing too intense training for a body that is not ready or used to doing it, or that is really pushed to the limits a bit too much, might be a risk for contracting that same virus. And you don't want to be there. You don't want to go there in current times. So that has consequences, I think, for elite athletes. And I look after the Swiss national triathlon team. And we've told the athletes, we would like you to avoid sustained high-intensity exercise. Now, sometimes to do interval training and do an intense session is probably okay, and that's part of training, and that's part of boosting your system and making sure that you keep your training levels. But it's not the time now, with every uncertainty or the certainty that competitions have been cancelled, etc. It's not the time to train at your maximum and try to dig your hole as far as fatigue and immune system goes. Now, that's for the elite athlete. And to go back to your question, you were talking about, is there a risk for people who might do too intense activity? I certainly see that risk, because as much as people have been stuck at home, there's been a lot of offers online of people being very creative and imaginative and supportive of people being locked down in their homes to offer training programs at home and video classes, etc. And the problem with that is that there's not so many things that you can do within your home. And oftentimes, people will revert to a program that involves jumping around, lunges, squats, burpees, jumping jacks, mountain climbers, whatnot. All these exercises that are feel-good exercises, but that if you do too much, or even if you start doing for a few sessions and you're not used to do it, you're going to have knee pain, hip pain, or Achilles pain, or whatnot. But also, it might tire you because you're not used to doing it. It can be very intense. So that's not the goal.
Yeah, I fully agree. And what do you make out of the findings that it seems that the obesity or even overweight is very related to COVID-19 and the ICU? So people who are in the ICU from coronavirus seem to be more overweight and obese than in the normal population.
Yes, so obviously the data just keep coming in on the risk factors that are identified to end up in an ICU or under a ventilator with COVID SARS-2. And I'm not really sure of the validity of all the data that we see for now, but I have talked to some friends who are leading ICUs in our university hospitals around here in the Swiss region. And they definitely have mentioned that there's a lot of prevalence of overweight and obesity in the patients that come in to the ICU. Now, of course, the debate here is that people that have comorbidities, that have diabetes, that have cardiovascular issues, etc., or chronic diseases tend to be also more overweight and obese. So it might just be a confounding factor that we have, and just some correlation there, or not just a causative effect that obesity leads to more severity in COVID-19 symptoms and hospitalization criteria. But we still have to look at this and say, okay, probably if you're in worse health, or if you have overweight and obesity, that might be a risk for you. So the question becomes, can you do something about it? And now, in these weeks, I guess you can't do much about it. Although within a month, people can lose some weight if they do an adequate training program and they pay attention to what they eat and how they eat, etc., and they rest and sleep and recover. But the question, I think, becomes for the future, because we don't know what's going to happen. Obviously, this might be a one-off coronavirus outbreak, but it's not the first outbreak in the last years. There may be more, and people are still discussing whether, we don't know. Is it going to be seasonal? Are we going to have recurrences? And if that's the case, we really need to look at those risk factors for severe symptoms, and we need to start to address them. And if obesity ends up being one of them, it's one more reason to address obesity very directly through measures for public health. Now, having said that, excuse me, it's not new. Not new that we need to fight obesity and we need to get people to have a better metabolic profile, etc. But I think sometimes it is also about looking at the positive effects that we can get from a crisis like this one. And one of them is the awareness and the importance of some health aspects. And that's where I think there's a way to promote physical activity in a different way also, not to scare people from the recurrence from coronavirus, but just to use the awareness that people have of the importance of their general health, overweight and obesity being part of it. And then physical activity and other aspects of health promotion and prevention need to be integrated.
I think that's an important point. And like you said, it might be recurring, the coronavirus, yearly. And basically, we are not going to get rid of it before a big part of the population is infected and then immune to it, or we have the vaccine. So this might take some time. And I think for many people, if they know that they can improve quite much their chances of surviving or not getting the coronavirus serious, I think it could be a good time for this kind of rehabilitation before you might get infected.
Yeah, I think that's you dropped a term there, prehabilitation. So what do we mean by prehabilitation? It basically means whatever we can do to improve the condition of our physiology, of our body, of our metabolism before any type of major health event happens. You might consider major surgery. So let's say somebody has a scheduled surgery. We know that if we improve the physical fitness of that person before they go into that major surgery, there's a strong effect on the number of days you will be spending maybe in the ICU, the recovery time after your operation, etc. So if you do that prehabilitation before the operation, you will have a better outcome, and also it will cost less to the healthcare system. So that's a very good investment. And if you can also create a positive habit of keeping fit and looking after your health through that, well, then I think it's a win-win situation. Now, it's interesting. We've had these studies for a while on major surgery and prehabilitation, yet it's not done. It's really not even integrated into the healthcare system. The question being, who would conduct the physical training before a major surgery, for example. Now, physiotherapists can do that, and I work a lot with physiotherapists. They're really my first partners there. But oftentimes, they're not really trained for that prehabilitation and physical conditioning. It's not directly their job. Now, some of them have developed an interest and have done maybe sports physiotherapy or cardiovascular physiotherapy, and they have developed an interest in that and also are competent. But there's also a lot of physical activity coaches in adapted physical activity for health that are being trained in universities everywhere, especially in Switzerland as well for the last 10 years. And they haven't found their place in the healthcare system simply because their services are not being paid for by insurance companies. So the healthcare system will not pay for you to go to a coach to get fitter before a major intervention. Whereas we know that this will reduce the cost overall and will potentially have a lasting effect on your positive routine and approach to health. So that's something that needs to change, and we'd like to see it change, but it requires a lot of political lobbying. And maybe, again, the pandemic and the consequences of the pandemic need to have consequences after that, as far as how we understand prehabilitation, maintaining good health, and physical conditioning or physical activity for health.
Yeah, I agree. And I think the good thing with the rehabilitation approach is that people really should have a higher motivation in this situation, because they know that they are going, for example, for a major surgery, and survival from those are not always so good, or there's quite a big risks. And the evidence shows very clearly that better your fitness is, better your survival rate. So I think there would be an advantage on the motivation there.
Yeah, for sure. And I just want to make one thing clear, because I haven't said that, and sometimes we could take a shortcut, and we shouldn't. We don't have data that tell us that if you are fitter, you suffer less from COVID-19 symptoms or severity of the disease. Okay, currently I haven't seen any data that say, if your VO2 max is higher, then the likelihood of you suffering from long-term symptoms or for a longer stay in the hospital is higher. We can maybe think it's a hypothesis based on all the prehabilitation knowledge that we have for major ICU stays, etc., and also the fact that people who are more overweight and obese tend to have more severe symptoms. We can make a hypothesis that being fitter protects you more against these outcomes. We will need to see the data. I don't know to what extent we'll have such data after this pandemic, because, and here we come to a major problem that we have, is that as much as many people know their cholesterol level, or they may know their blood pressure levels, or they certainly know if they're overweight or not, because weight and height is easy to measure, people don't know what their fitness levels are. We can always ask them how much active they are, and we have standardized questionnaires to estimate their physical activity levels, and this in turn indirectly estimates their physical fitness, and we can work with that. But it would really, I think, at some point be necessary, I mean, we're way past that point in my opinion, to have physical fitness measured systematically over the lifetime. In one way or another, there's different ways to measure it. We don't need to be too complicated in how we measure it, as in lab testing. But we should have a good sense of how physically fit people are or not. And that will enable us then to know how much it plays a role in disease and morbidity.
Yeah, I agree. Do you have any ideas how should it be done? You could use like heart rate variability in the rest. You could maybe use like GPS to measure the distance and the heart rate during that, and you could estimate the fitness. It would probably classify people quite well in a population level. Do you have any suggestions how should it be done?
Yeah, I think you're making very good suggestions, and a simple walking test that measures the distance, so you get the walking speed, and that measures heart rate, so you get a sense of intensity. Now, obviously, heart rate is personal, and you would have to correlate a little bit the heart rate of the test to the variation in that heart rate over the course of other activities, etc. So it could really sort of personalize the test as far as heart rate analysis goes. And so that's doable. And it doesn't have to be difficult. You can do a 1 kilometer or 2 kilometer walking test and see how far people go, how fast people go, and also how the heart rate responds. You can then look at heart rate recovery just after the exercise for 1 or 2 minutes. And we know that if it goes down by a certain amount of beats in the first minute, that's a good sign of fitness, and etc. So there's ways of doing this. I would personally like to see those embedded into smartphones and smartwatches, so that there's a simple standardized test that says, go for a walk, go at an easy pace, give instructions on the pace based on something like the Borg scale, but just on, be slightly out of breath, not sweaty, etc. And then do the same walk another time, but now you want to be out of breath and you want to be pushing a little bit more. And we can assume that like these two tests would be maybe a 3 out of 10 on a Borg scale, and the other one would be a 6 or a 7 out of 10 on the Borg scale. And then you could compute their fitness levels like that. Seriously, the AI power of these devices, and then you can integrate the heart rate variability alongside that. And I'm not an expert in heart rate variability. I'm still struggling to understand everything about it, but there's people that are, and I think you can estimate fitness very well doing that. And a lot better, actually, than what BMI gives you as far as metabolic health. Because BMI only measures weight and height, and it doesn't measure the composition of the body. So, I mean, I have athletes that are overweight, but they have 10% body fat or 12% body fat, and they're very fit. So BMI is not a good measure. And I think that we can do very well with the smart devices that we have today to estimate fitness.
Yeah, I like your idea that it would be a walking test, and actually you can have the wearable, because if it's tracking the heart rate, it could actually give some kind of audio guidelines for the intensity, that if the heart rate is too low, it could encourage to walk a little bit faster and then slow down if it goes too high. So I think there's a really good possibility to develop really easy test.
Yeah, and what's great about that is that you can then repeat it after you've initiated some regular physical activity, and people will notice the improvements. And they can be easily tracked because, again, if the device through audio feedback tells you, well, you can accelerate a little bit now to get to a target heart rate, and they'll notice for the same 1 kilometer walk, they've done 30 seconds less after a few weeks. Well, that's already an improvement. And what happens usually, they'll notice that they've done 2 minutes less for a 1 kilometer walk, which becomes a great improvement. So this is also what I look at actually with my patients. When some of them have acquired devices like a GPS-enabled watch, and I can log on, or they put things on Strava, for example, and usually people stick to their routines. Okay, so when they have a nice walking path, they'll repeat the same one regularly, which is really nice, because then I can look at that path that they've done today, and I'll look 1 month ago, the same course that they've done. So you have the same distance, the same incline, etc. And you look at the time and the heart rate, and it's fascinating. Sometimes they'll see that they've done it faster for the same heart rate, or sometimes they've done it in the same time, and they say, oh, but I haven't really improved my time. And I say, but how do you feel? Well, it feels okay. You look at the heart rate, the first time it was 135 average, the second time it was 115 average. So that's a huge improvement. Now, there's confounding elements. Okay, we've got to be careful always. If you look just at heart rate and not at the general picture, you might be misled by arrhythmia or other elements. And this is my job as a medical doctor, to consider all these elements. But we can really track progress. And I think a simple test that would be spread across the platforms that people have nowadays, and as we know, as much as digital technology is evolving, there's only a few big ones out there that control everything, and they could come up with a simple test like that. And amazingly, I haven't seen it. Have you?
No, not at least in widespread use. There's nothing, I think. And how do you see, you much earlier you said that kind of the activity trackers are in the client-oriented model. What do you see that is needed for a more medical-oriented model, that these trackers would be actually designed for medical use and would support the work of medical doctors?
Yeah, well, I think first, the reason why it's not been really developed in that sense is also because of regulation. Whenever you talk about medical interaction or measuring elements that are linked to health in a specific way, labeled as medical, this device becomes a medical device. And so, again, I'm not an expert in regulation of wearable technology and what the labelings are, but I know that as soon as you label it medical, it becomes a problem. So the tighter regulations are there, and then it doesn't touch the same market. So it's not the same thing to have a blood glucose portable monitor for a diabetic patient as far as regulation goes, and to have small steps or heart rate tracker. But what's interesting is that they're all linked to health, because a heart rate tracker can detect arrhythmia now. And there's some good studies to show that smartwatches can detect irregular heartbeats and potentially flag something that might be like an atrial fibrillation or something else. And it might inform the doctor that this needs to be looked at. So I think we are going to cross that bridge where these devices have a value in the interaction with the health sector. The difficulty lies in how the regulation will go and what we do of the data, how they're protected, how they're stored, etc. So I think those are issues, and I'm not completely familiar with them and the solutions. What I think also is, I mentioned this at the start, there's been a resistance from the medical community at large on devices and tracking. I remember I had a student do a survey in general practitioners in the French-speaking part of Switzerland a few years ago on whether they were using any apps for patients to monitor some health parameters, just weight or just blood pressure or some other aspects and there's many apps out there. And whether they were seeing any value in it or whether they would want to be using mobile technology. And it was fascinating to see that 95% of them not only were not using, but were reluctant to use such tools. And we know that this is not where the patient is going. The patient is going in a direction that they want to know what their data are. They want to be able to measure. And what I see in a lot of patients is that they're happy to measure things and record them on some device, but they also want to make sense of it, and they want you to help. And that's where we as healthcare practitioners must embrace technology, even though it has limitations and regulations need to be considered, but we have to embrace it for what it is. If the patient is already using some apps or some devices, it is our duty first to ask, are you using any devices to measure things? Then to look, and then to make sense or help the patient make sense of it. And I think that's the approach that we need to have.
It makes all the sense.
This podcast is sponsored by Fibion.
My name is Dr. Paul Batman, and I'd like to just say a few words about Fibion. I've used it a number of times on different projects that I've been involved in and find that it's incredibly reliable, very valid, and incredibly sturdy. I love the graphics that come with it. It really is very clear and can easily see the active and inactive periods as well. So I'd certainly recommend Fibion to anyone that's interested in finding out more about sedentary behaviour, particularly the concept of sitting and how we can possibly break it up with some really good, valid information.
And as you have been working quite a bit with the athletes, do you use it as a tool for injury prevention? I'm thinking like here that you can see, for example, the progression of training load, and if there's, for example, like you mentioned, the knee pain, do you use it in such a way?
Yeah, absolutely. So there again, it's teamwork, right? We've got to see this with a bit of a constellation of people participating. So obviously there's the athlete, but then there's the coach. There may be a regional coach, there may be a national coach, there may be a personal trainer, there may be a physiotherapist, etc. So usually what we have and what we try to establish within the elite populations that we follow is that they monitor how much training they do, which means they have a platform where they upload their data, they enter the training they've done, and we can have a look into it. So we try to share that data within a specific team, people that are designated that can have a look at the data. And then if we spot something that seems like could be a risk for an injury, and we're talking about load monitoring mostly and load management. I look after triathletes a lot, and they will send me every week or every other week their training platform, or I can log on and have a look whenever I want, but they will also send it directly. So there's the act of sending the report to the other practitioners, the coach, etc. That's important. I'll have a look. And if I see that there's a spike in a week or two of running volume, for example, they've doubled how much running they do, we know that this is a risk for injury. So I will get back to the coach and I'll get back to the athlete and say, yeah, how you doing? Just make sure if you feel something in the next few days or weeks, you got to take it easy. And what's happening with your running volume? Are you pushing it for a reason, or what's happened, etc. So we'll have that multidisciplinary discussion in order to make sure that they don't push it too hard at some stages. So we'll definitely do that with the athletes.
Yeah, that's good. And related to coronavirus and athletes, especially like for triathletes, the lungs are really important. As a medical professional, have you heard about, now the media is concentrating on deaths and so on, but if you are an athlete and you get the coronavirus infection, you recover it, but you had some symptoms, is there any long-term effects on the lungs?
I think it's too early to know, but I can tell you, I am currently thinking of at least a couple of athletes that have been struggling with breathing issues, not very clear, etc., for a couple of weeks, that haven't really been sick. They haven't had typical symptoms of coronavirus, and we are really thinking about that. So we don't know what the evolution will be, whether it is so that they can have persistent respiratory limitations. And these limitations in a normal person that's not training at high intensity would maybe not be noticed, because in everyday life or moderate activity, they wouldn't notice it. But as you know, with elite athletes, whenever you're pushing it hard and they have their goals, etc., they will feel it. They will have limitations in breathing that can happen. And maybe that can be a consequence of coronavirus pulmonary remnants of the infection. Now, it wouldn't be the first case. We know that viral infection that wasn't just limited to the upper respiratory tract, but that really went into the bronchi a little bit, oftentimes causes limitation in breathing in the athletes for weeks after the fact. I've had athletes for 4, 6, or 8 weeks, they've been limited. The other thing that comes also now into play is that we have the allergy season in Switzerland and in Europe that's in full bloom. And there's a mix also of effects of potentially viral consequences, but also pollen and other allergies that might kick in.
Yeah. And yeah, like you said, we don't really know, are there long-term effects on the lungs? What would be your kind of educated guess for the athletes? Should they be, how much they should be avoiding getting the infection, or should they concentrate more that they get their training done because they are fit, they probably get, they don't get serious effects?
Yeah, it's a difficult one to answer. The first thing is the message I've been giving to athletes is now is not the time to be focused on maximum fitness. It's the time to be focused on maintaining your health and your fitness levels, okay? So keep training, but also use this time because it's a different time in your lifetime, hopefully the only one, but it's a different time. And as happens with any injury, I will also tell them, look, an injury is an opportunity for you to use your time differently, okay? Now you have more time or to think about things in a different way. So it might be for an athlete to learn a little bit about their sport, become a student of your sport. That's also important. I've certainly experienced that when I was a basketball player, studying other players, the best players in the world and all that, at times brought my playing level to a different position. So I think that's also one thing they can do. There's also a good reason now to focus a bit more on education, maybe. And because they have more time, they're not going to be outside all the time. And the other thing is, as far as the risk of the disease, with the discussion we had previously on high intensity training and the risk of being infected probably potentially is present. So that's also another reason to not push their training right now. The other thing is there's a few athletes that I have that were training for the Olympics. Now the Olympics have been postponed. And for some of them, I've had a chat to them after the Olympics have been cancelled. And it was a huge relief. So I think another aspect that needs to be, that's not minor, is the mental health and the stress component of the situation. Again, we don't work alone. I work with the sports psychologist as well. And for some of our top athletes, it's also a time where I would push them to make sure that they take time for them, for their mental health, and to ease the pressure off a little bit and maybe learn new techniques or maybe spend some time to focus on their mental strength as well.
Yeah, really, really good points. So
And
we have talked.
I guess, I guess it's also very important. We've talked about it in the media a lot about people in general, not just athletes, being locked in home a lot of time and also having kids at home and doing homeschooling. I know that for myself as well. My kids are at home. I have 2 little kids. It's also pressure. It's also stress and you have to cope with that. Now, doing some exercise helps relieve that stress. And one thing I would encourage people to do in the current situation, in the extent that they can, if they can go outside for a walk or for a little activity as a family, respecting social distancing and the requirements and the rules of your country first. But I would encourage them to do that because it helps connect. It helps relieve the stress and cope with everything that's very different in current times.
Yeah, I couldn't agree more. Yeah, so we have talked over an hour and maybe we have covered 1/3 of the bullet points we had in the list that we could discuss. So I would suggest that we have another episode recorded at some time later. I would like to talk about the other points, but I think it's good time for this episode to finish soon. So would you have any final remarks or any themes that you would like to brought up in the discussion?
Yeah. Well, thank you. I mean, it's great chatting, and I guess I'm speaking too much, but that's what it is.
No, not at all.
Maybe one thing is, and this would be more for the professionals out there and the healthcare practitioners, and also fitness people and physical activity researchers and all, is to always keep in mind that we love science, we love papers, and we love facts, but that at some point, what matters to people that we're trying to help, is how do we apply what we've learned in the real world setting? And that's easy to say, right? And everybody will say that, of course, we know it's not just pure science, it's how we can apply it to people. But people are made of their history, they're made of their experiences, they're made of the current status of their body, and also their environment and what motivates them. And our role is not just to apply the science directly, but is also to take into consideration all of these elements. Post-COVID-19, whenever that happens, whenever we can draw a line and say this is post now, hopefully soon, it will be very important to address what the coronavirus pandemic meant to these people, to identify some opportunities for counseling, to identify some potential stressors or some misunderstandings. And I think that's to keep in mind.
Yeah, that's a good point. And I think I will take a point from you that having been in the Swiss mountains for a couple of weeks, I think they are probably the best motivators to do physical activity and stay fit that you can actually go there. So that's my final remark for this episode.
Well, Ollie, I'd say if you do come back to Switzerland, we're going to have to connect in real life, of course, and there's some very nice paths and very nice places that we can go to in the mountains for sure.
I would love to do that. So thank you a lot for taking the time for this podcast, and I would love to do another episode at other time from the other themes that we didn't covered his time. So thanks a lot for taking the time.
Fabulous. Thank you, Ollie, for the opportunity and the great questions. And I wish everybody out there safe times and stay at home, but also be active and use what you can do. This is also an opportunity to learn new things and to make new experiences. So stay safe and see you soon.
This podcast is sponsored by Fibion. Get scientific validation and learn more about Fibion at fibion.com/research. The Physical Activity Researcher podcast has created an activity tracker purchase guide for researchers. Get your free copy from the link in the podcast description.
Thank you for listening to the Physical Activity Researcher podcast.